The Centers for Disease Control is warning people to stop using e-cigarettes. The reason? The number of possible cases of vaping-related lung illnesses has more than doubled in a month. Right now, there are more than 450 possible cases in 33 states. Health officials say at least 5 deaths are likely linked to vaping. Dr. Jon LaPook joins us now with more. John, good morning.
Good morning, Dana. The CDC says the reason people should consider not using e-cigarettes is that the investigation is ongoing. And though the agency believes a chemical is involved, there's no definitive cause for the lung illnesses.
The CDC reported a 3rd death in Indiana, in addition to 2 others in Illinois and Oregon. Still under investigation are 2 more deaths in Minnesota and California. Pam Pontonis is with the Indiana Health Department.
Vaping is the only common factor in these injuries to date. Many individuals have reported vaping THC, the ingredient in marijuana, or other substances, but we do not know what else may have been in these products.
A study released showed both THC and nicotine were involved. It described 53 cases of vaping-related lung disease since April in Illinois and Wisconsin. Most were healthy males with a median age of 19. 37% of patients reported vaping only THC, the chemical in marijuana that produces a high. 17% reported only using nicotine products, and 44% reported using both. 18-year-old Piper Johnson was on her way to college when she wound up in a Colorado intensive care unit.
Had I waited 36 hours longer, I probably would have died or been put on a ventilator.
The CDC did not identify any particular brand of e-cigarette, but expressed particular concern with vaping products purchased on the street or tampered with by users.
The American Vaping Association says the CDC is creating anti-vaping hysteria and that adult smokers should not be scared off from using store-bought products to quit smoking.
I think anytime you see something this serious, you understand why there's so much concern. There's still so much we don't know, though, right now.
Yeah, it's true. And remember, there are 2 different things here. One is that people right now are getting these lung illnesses, and it seems like it's something in the last 6 months or so. So it's something new. There's been vaping going on for a long time. But is it something that's in the street product that's possible? We really don't know. But remember that the e-cigarette device is like a chemistry set. You're putting all the stuff in and you're brewing it up, and who knows what you're creating.
So often we see these diseases developing, these smoking-related diseases developing much later after a long time of use. The median age here is 19. What's going on?
Yeah, and what that does is it shows that this is a young person's problem, right? And that's the whole thing. You can say, well, okay, we're using vaping because we're stopping people who are smoking cigarettes from smoking them, and that's a good goal. But if that was the marketing goal, right, it was a huge failure of that marketing goal, because it turns out that the huge explosion has been in young people. So if it does turn out that it's nothing that's in the normal store-bought e-cigarette devices, and it's something that's being added and found on the street, that's one thing. It doesn't negate the fact that these young people should not even be using these vaping devices in the first place.
A lot to think about. Dr. Jon LaPook, thank you for being here.